Minot, North Dakota has been known as the Magic City since its founding in 1886. When the railroad encountered the impassable terrain southwest of Minot, work stopped for the winter. A new community grew nearby, and Minot had more than 5,000 people in just 5 months, as if by magic. Ward County, the City of Minot, and the North Dakota Department of Transportation have partnered to pursue federal RAISE grant funding for the planning, environmental documentation, and preliminary design of new roadway connections near the city of Minot. Minot's accessible growth-driving intermodal connector, or MAGIC, will help deliver on over 2 decades of prior planning efforts that have called for transportation connections in the same challenging landscapes southwest of Minot. An investment in MAGIC will provide the opportunity for a region to solve its complex transportation needs, the same way Minot's resilient people did over 130 years ago. Minot is a growing area that serves both local and regional freight traffic. This growth is especially apparent on U.S. Highway 2, where local city growth conflicts with regional traffic. As many as 18,500 vehicles travel on US 2 and US 52 per day, and as many as 27,000 vehicles travel on portions of US 83 per day. During peak travel periods, delays are as high as 35% on segments of the corridor, creating additional need for traffic relief. Major developments such as the relocated Trinity Hospital or regional projects like the Port of North Dakota are expected to drive traffic growth through this area, leading to a forecasted increase in delays of several minutes. Along the corridor, there's a clear connection between safety and traffic issues. Nearly 75% of all crashes at or south of US 2 occur in areas where delays are nearing unacceptable levels. What's worse is that the supporting county roadway system experiences even higher crash and severity rates due to challenging curvature, frequent access spacing, skewed intersections, and lack of shoulders and clear zones. As traffic builds, either on the state or county system, crashes are expected to rise at an exponential rate unless improvements are considered. Some segments of the roadways in the project area are used by more than 2,000 trucks per day, which doubles the risk of congestion and nearly triples the risk of crashes resulting in serious injury or fatality. In addition, truck delays impact the local economy and the national supply chain due to the rare convergence of 3 U.S. highways in one area. Local agricultural traffic also experiences significant challenges. To meet the demands placed in this area due to growth and improve safety conditions, project partners are looking at new Southern Connection routes. This route aims to reduce truck traffic from the urban core and make room for an additional route. The Connector Corridor study completed in 2022 laid the groundwork for MAGIC and brought together representatives from Ward County, the City of Minot, the North Dakota Department of Transportation, elected officials, project stakeholders, landowners, and members of the public. Before analyzing potential solutions for the area, the project team completed an extensive examination of existing conditions, including safety issues, existing road networks, traffic and travel delays, and environmental constraints. In the winter of 2021, the project team used the information that they had gathered earlier in the project process and began alternative development. This involved evaluating key intersections and routes to identify what improvements would be the best fit. The project team created over 50 potential alignments and intersection alternatives. The alternatives were evaluated based on environmental compatibility, economic viability, and technical feasibility. Through this evaluation, we were able to generate potential alignment alternatives that are best suited to the project and meet all project goals. The project team gathered response from key stakeholder groups, including freight carriers from the agricultural, aggregate materials, and energy sectors, emergency service providers from healthcare, emergency management, 911 dispatch, ambulance, fire, and law enforcement agencies, economic development and tourism agencies, and the Minot Air Force Base. Additionally, meetings with landowners and the public helped determine that 76% of respondents favored improvements. The combination of routes developed provides safe and efficient access to the new Trinity Hospital, reliable movement of freight and materials outside of the urban core of Minot, and a more complete network for emergency providers to travel through a rapidly growing region. An investment in MAGIC will continue this critical project's momentum leading to a more complete roadway network, serving 15,700 vehicles per day and providing improved safety and performance of the U.S. highway network. By 2045, MAGIC will provide over $8 million annually in benefit by providing significant improvements in safety and travel times. A reduction of 27,000 hours per year of vehicle hours traveled for trucks in the region means North Dakota goods are reaching the global market faster. Improved routes to the new Trinity Hospital provide access to this state-of-the-art facility from Minot's downtown, Fort Berthold Reservation, Turtle Mountain Reservation, and the rest of northwest North Dakota that the hospital serves. Overall, more than a quarter of North Dakota's persistent poverty census tracts and 2 tracts in eastern Montana would benefit from improved travel times to Trinity Hospital. Prior projects have had the support of the community, stakeholders, and agencies. We have included letters of support from these key project partners, and together with your investment, we will make MAGIC happen.